We're here at Interfaith to talk about our new emergency department that is going to exist. And so I'd like to introduce members of our team, Dr. Chung, who is our chair of our emergency services here at Interfaith Medical Center, and Donna Green, who is our senior vice president for planning, and actually our key person who's working on our Kings County Transformation Grant, which is one source, just one source, of the funding for the emergency department. But most importantly, we're here to celebrate that our Congress member and our senator have blessed us, frankly, with providing additional funding so that we can complete the multi-phases of this very, very important clinical services for our community. And so with that, I will step out of the way, and I will let Dr. Chung talk a bit about what our current emergency department is, the number of people we serve, the number of visits we have, the fact and the range of services that are provided in what we now have of a too small, too old emergency department.
Good morning, everybody. Our emergency department at Interfaith serve approximately 40,000 people a year. And out of those, about approximately 13 to 15% of those patients, depending on the year, is broken down to the psych patients that we actually see. And on top of that, we also take care of patients that require detox. And we have a detox unit upstairs on one of the floors. And we also serve the pediatric patients that come to the emergency department. Currently, the size of the emergency department is really, like Ms. Brown said, really small. There's really not a lot of private rooms for patients. And there really is not, and even the equipment that we have has been there for many years, and we're so happy that we're getting this grant and this money because we needed it for our community. Really, our community deserve it, and we're so happy that we're able to share this with you guys today. I hope that we're going to continue to use this to serve those that actually have not been here before. Once we have a brand new ED, we're going to have more people coming in, and hopefully we could actually increase our volume in the emergency department and serve more people in this community.
Good morning. To my left here is the 4 phases of the emergency department modernization and expansion. The red area towards the bottom is our psychiatric emergency department. That project is in progress right now, and it ends in July. And so we'll have a new psych emergency department. You will see at the bottom here the future state, some of the areas. So right now, and actually in front of Dr. Chung, when you look at those, right, towards the bottom, you'll see a secure holding area where it's just, a room. Here in the secure holding area, you see that there is a television, and, we can play music, we can show things that will help to calm our patients. We also will have more of a waiting area, and this area will be right in the emergency room, so we don't have to transport patients to another area. And just as Ms. Brown was saying earlier, this work, included, completely gutting a certain area, expanding it, and also putting in new utilities, new oxygen, med gases, and also all of the infrastructure. Then we go to phase 2, which will start in July, which through the thanks of our senators and the leader here, we have with this new area, we'll deal with our trauma area. So if you look at that picture down there, that very packed trauma area, so imagine someone needing trauma services and doctors are having to jump all over the place in order to take care of the person. Now we will have this area here, this future area, which is larger, which allows this appropriate circulation. If you look at that green area there, sort of in the middle here, shows the flow into the trauma area. So this this modernization piece allows us to have better flow for patients and staff to get to that area. The final 2 phases, so 3 and 4, you'll see these here, and these get to our waiting areas. We had community focus groups come in and tell us what they needed, and Ms. Brown had mentioned we need, a certain area for children. We need a specific area for children. So we have now a pediatric waiting area and an adult waiting area, so kids can be, and their families can be together. And it also, we have vertical care areas, so not everyone needs to be lying down on a stretcher when they come in an emergency room, and so this will allow us to, have, asthma care or other care for conditions that don't need you to be lying down. It takes up less space, allows us to care for more people.
What's really important is what we try to do at One Brooklyn and Interfaith Medical Center is to actively engage our community in our current activities, but also our future plans. And so we hosted a series of focus groups with members of the community, some members of our board, members of the community planning boards, some representatives from our elected officials, to say, what are we doing now that we can improve upon? How do we leverage these grant dollars to give you what you want? And that informed the design of this new emergency department. And so we hope that our community will be proud of the work when it's finished. And I never want to have more people come to an emergency department. What I want, however, is when they do come to the emergency department, that we are serving them with respect, that we are providing them with the great services that we already do, but that our staff can do their great work in environments that are conducive to them being as effective as possible and that are comfortable for our families and our children. I'd like to introduce Leader Jeffries, a stalwart supporter of One Brooklyn Health and Interfaith Medical Center, and I just can't say enough about Hakeem Jeffries in terms of his support for all of his constituents in Brooklyn, and particularly for health care services. So, Leader Jeffries, I'm stepping aside.
Thank you. Good morning, everyone. Good morning. What an honor and a privilege to be here with you, Lorraine and Alex, our tremendous board chair, and of course, Reverend Waterman, and vice chair, and Maurice, all the distinguished members of the board, the healthcare heroes. We're thankful for the doctors and the nurses and the providers, for all who, under Lorraine's great leadership, provide tremendous care for the people of Central Brooklyn here at Interfaith Medical Center. I'm certainly thankful for the tremendous leadership and partnership of Senator Gillibrand and, of course, Senator Myrie, who you will hear from momentarily. The One Brooklyn Health system provides tremendously important care to tens of thousands of individuals, if not hundreds of thousands of individuals here in Central Brooklyn, in communities that have traditionally been under-resourced. In terms of the emergency care in a community that suffers from disproportionately high rates of many chronic illnesses, it is critically important that the healthcare heroes here at Interfaith Medical Center and across the One Brooklyn Health system have the ability to do their tremendous work in the most modern environment possible. People here at Interfaith have been providing high quality, compassionate care, 21st century care in 20th century infrastructure. And so what the modernization of the emergency department will allow is for the people here at Interfaith to provide that 21st century care in a 21st century environment. And that's why we, Senator Gillibrand, myself, Leader Schumer, worked hard to try to secure some additional federal resources to enable the people here at Interfaith to continue your work, to be there for individuals that we're privileged to serve in their time of need, particularly when they are confronting a health care crisis. And so over the last year or so, we had the opportunity finally to try to designate a handful of community-based projects for additional federal assistance that we deemed as important in the quality of life for the people that we serve. And so thankfully, in this most recent spending agreement in December, with the leadership of Senator Gillibrand in partnership with myself and Senator Schumer, we were able to secure for this emergency department work an additional $3 million in federal resources. And we're proud to announce that today and to bring those resources home to the community. At the same time, as our discussion revealed earlier this morning, we're going to continue to work for structural change to make sure that safety net hospitals who care for the most vulnerable amongst us can receive the additional resources necessary to be able to continue the great work that you undertake on behalf of our communities. And I know Senator Gillibrand and I, at the federal government level, and Senator Myrie at the state level, are committed to making sure that we can bring about that structural change so that safety net hospitals, such as the ones that are part of the One Brooklyn system, can receive those resources. And that is our commitment to you. Let me now yield to our distinguished senator, who's been a friend of this community, a leader for the state, a champion for the least, the lost, and the left behind, for the poor, the sick, and the afflicted. I won't go through the whole alphabet, y'all. But I could, because that is the type of leader that Senator Gillibrand has been for us, and it's my honor now to yield to our great Senator, Kirsten Gillibrand.
Thank you very much, Leader. Well, we are blessed with so many amazing leaders here in Brooklyn. Leader Jeffries is going to be the Speaker of the House someday, and we are very proud of him for his leadership here in this community, but his leadership for the whole state and the whole country, and it's a real blessing. I want to thank Lorraine Brown for her leadership and her vision. This is a vision, and your advocacy and your presence and your determination to get us where we need to go is exactly the kind of inspiration that your elected leaders need so that we can implement your vision, get the resources, make the structural changes necessary. So thank you for being our leader. I want to recognize the other leaders here among us. I want to thank our chairman of the board, Alex, for his very persistent work and for his determination to meet the goals and the needs of this community. To our hospital leaders, our doctors, to our board members, thank you for the work you do to make this hospital network thrive. Without you, it wouldn't happen. So this is really a community effort, and I'm very, very privileged to be part of it. I think what we've heard today is about what we need to do to help those most in need, to help these critical care and safety net hospitals, to make sure that patients here get the same care that any patient anywhere in the state gets, to make sure that they have the resources and the facilities that meet their medical needs. And so announcing this $3 million today is extremely exciting because it just helps facilitate these changes for the emergency room that, as you can see, will just be able to provide better care to patients who are having emergency episodes. This is very important for the health care and well-being of this whole community. This hospital is one of the most important safety net hospitals of the region, with 50,000 annual visitors into this emergency department alone. It shows the need. It shows the extreme need and the burdens placed on this facility that need to be met with more resources and more ability for them to be able to meet those needs. We've seen our frontline and safety net providers really carry the weight of the last 3 years. This pandemic has not been easy on safety net hospitals. We know that a lot of our communities who have been underserved come in with worse medical conditions and worse medical outcomes because of decades and decades of lack of investment into their community, into their well-being, and into healthcare for them and their families. And so helping the safety net hospitals that helped us in our greatest time of need is our highest priority. And I'm very excited to work with Leader Jeffries on solutions, long-term, structural solutions that can help safety net hospitals provide for the people they need. I also want to recognize our state champions, because without amazing state senators like Zellner Myrie to carry the charge in the, not Congress, in the Assembly and State Senate for our state government, we wouldn't get this done either. We have state solutions that our senator is working on that is very profound and important, working with our governor to try to change how we receive our reimbursements here in the state. I think that's really important work, and certainly the congressman and I will lift up that advocacy so that you can be successful and you can create the momentum that's needed to change laws. So thank you for letting me be here. I'm now going to introduce, did you want us to say a word? You should. Zellner Myrie.
All right, thank you. Let me express my deep gratitude to our Senator Gillibrand, and to Leader Jeffries for their federal investment in this institution. During the height of the pandemic, a lot of us stood outside, we applauded our healthcare heroes, we banged on pots and pans, and then the pandemic abated, and that same level of enthusiasm also faded. And so I'm really grateful that our federal partners are here today saying that we are worth it, we are valuable, and it's not just about an applause, it is putting your money where your mouth is. And also, selfishly, I was born in this hospital. So I am...
I was thinking Congressman Jeffrey born here. This is why he was talking.
Yeah, so I am very selfishly grateful for this investment. Our community thanks you, and thanks Lorraine and the entire team here for their leadership at this moment. Thank you.
Thank you.
Lorraine Brown, CEO of One Brooklyn Health and Interfaith Medical Center. And what happened today is an extraordinary celebration of a $3 million grant that we received from our Congressmember and Minority Leader Jeffries, our Senate Leader Schumer, and our Senator Gillibrand. And they came to see the Interfaith Medical Center and to walk through what their investment is in the rebuilding of our emergency department here at Interfaith Medical Center. A new environment for our patients who so deserve it. We will have new space for both our medical emergency department and our psychiatric emergency department. We will have separate space for pediatrics emergencies, a reworked trauma room. Basically, as Leader Jeffrey said, we're going to be able to do what we do now, which is 21st century healthcare, but we do it now in a 20th century facility. So now we're going to be able, with their generous funding and funding that we're getting from the state, to do 21st century healthcare in 21st century environment.
And this hospital is classified as a safety net hospital.
Yes.
Speak on that real quick.
Right. Interfaith Medical Center and the rest of One Brooklyn Health is considered a safety net healthcare system, safety net hospitals. Safety net hospitals serve the majority of their patients who are insured through Medicaid, and in our instance here at Interfaith, 50% of our patients are insured through Medicaid. Another percent are insured through Medicare. So safety net hospitals serve essentially folks who have government insurance. We have a very small number of commercially insured patients. That's not to say that we provide any care that is less than, but it's the community that we serve, and it's our commitment and our mission to serve folks who are low income and or who have special needs, and therefore are more likely to be insured by Medicaid and or Medicare.
Yeah, Hakeem Jeffries, Member of Congress representing the 8th Congressional District here in Central Brooklyn. Interfaith Medical Center provides a tremendous service and tremendous care to the people of this community. They are providing 21st century compassionate, effective, and humane care, but often operating in a 20th century setting. We have secured $3 million to help with the emergency department renovation to modernize the facilities here so that the Interfaith Medical Center and the healthcare heroes who work in this great facility can continue to provide a 21st century level of care in a 21st century environment. Yes, Senator Zellner Myrie was born here at the Interfaith Medical Center. I was actually born just down the street at the Brooklyn Hospital Center. But these are safety net hospitals that have provided care for decades, if not centuries, in the case of the Brooklyn Medical Center. But these are safety net hospitals that provide essential care to people here in central Brooklyn. The One Brooklyn Health system, under the leadership of LaRae Brown, is doing a lot with an inadequate amount of resources. And in Washington and in Albany and in City Hall, we've got to continue to make sure we're fighting to increase those resources, make the structural changes necessary so that the people here at the Interfaith Medical Center, the healthcare heroes, can continue to provide the level of care that our community deserves. What's up to the healthcare heroes here at the Interfaith Medical Center and all those healthcare heroes across the city of New York?
Hi, my name is Dr. Jeff Chung. I am the chair of the emergency department at One Brooklyn Health. Today we were fortunate and we're so happy to have the federal government and Jeffries and Senator Gentleman come here to give us a check of $3 million to help fund a project that we've been so passionate about, especially I'm very passionate about, which is our emergency department. Our emergency department is very old, and the infrastructure is very old. We have we process approximately 40,000 patients a year, and the current state that we have, the equipment is broke, old, and that we're getting this fund because we're renovating for a new emergency department that is badly needed for the community. And we believe that we should be serving our community and have an infrastructure that's no different from people coming from other EDs in other institutions in the borough of Manhattan, in Queens. We should be similar. And so we're so happy that we're going to be having a brand new emergency department that will become 21st century and be able to serve the community that deservingly we should get in this community. Currently, we have board-certified emergency physicians here. The care that we give is no different from any other institution. It's just that we don't have the infrastructure that, in truth, deservingly for the patients that they feel comfortable in. Having new equipment, having an environment that is really, great for these patients when they come in need. So this is why we are getting a brand new emergency department for this area. We're also in the emergency department getting a psychiatric emergency department separate from the main emergency department. And the old one was just a room, a very big room that can house a lot of psychiatric patients. But now we're going to have a state-of-the-art, psych emergency department where there'll be areas for patients individually, and also the ambiance and the way that the structure is built. It's more conducive for a calming effect for these patients that are here that have psychiatric needs. If I was a patient, I would definitely want to come to an emergency department that is no different from any other emergency department. If I am a patient, I would definitely want to come to one that is similar, not equivalent to all these other institutions around the country.